Essentially, we're a community interest company that came together 4 years ago and involved all the GP practices in Tower Hamlets, currently 36. And we came together really to kind of support primary care, but also to think about what we can do in the community, how we can support the community, how we can support our practices to actually provide a better service for our patients. The opportunity of being part of the care group and the practices being within the care group is an opportunity to try and help them thinking about what can they do better, how we can support them to work better, but also to give us a bit of headspace, time and resource to think about ways that we can think about the future and meet some of the challenges that we have to deal with going forwards. The care group has basically come out of the creation of networks, and I think the networks were really kind of innovative and pioneering in the way that practices could come together and engage with each other in a way that historically they never had done before. And that ability to kind of collectively work together has been a really powerful thing in terms of outcomes for patients, but also in the way that GP practices work. The ability of going to the next step where networks could come together and become kind of a federation has just allowed us to take it to the next step, and hopefully that will allow us to kind of deal with all the big challenges that we have to face within Tower Hamlets. I think having the people who work for the care group, I think the energy, the enthusiasm, and I think the practices and the people who work in general practice, as well as all the other members of kind of community teams and health teams that work for us, and the opportunity to kind of almost like cross-fertilise and cross-pollinate with ideas with other groups of health professionals that historically we would never ever normally work with. We have to deal with we have lots of challenges at the moment. We've got financial challenges, we've got workforce challenges, we've got estates challenges. I think if we can somehow sort out some of those problems, dealing with some of those issues rather at an individual level, but at a network level and at a federation level, and if we can do that and put primary care on a good footing where not only are we sustainable but actually thriving, that's where I hope we can be.